Hello, it's Dr. Kiran, and in this video we are covering which is better for your child, ibuprofen or paracetamol. Now we will cover what paracetamol is, what ibuprofen is, which is better and why, can you use both, and finally what the risks are. So keep on watching. Now paracetamol is one of the world's most commonly used painkillers and is sometimes known as acetaminophen. We don't actually know how it works, but we think it stops the signals that travel to our brain and help us to feel pain or make our body hotter. In doing so, stopping these signals stops us getting hot and stops us feeling pain, which makes it a very, very effective pain-killing medication and fever relief. Now, ibuprofen is another very common drug that is used to control fever and pain in children, and it is known as an NSAID or a non-steroidal anti-inflammatory drug. Now, ibuprofen works by stopping the production of something known as prostaglandins. Prostaglandins do a number of things in our body, but importantly, they cause inflammation. Now, by stopping the prostaglandin, we decrease the pain and inflammation, which, although are a part of the natural healing process, aren't always helpful. So, which is better and why? Now, remember, although they have a similar effect on the body, ibuprofen and paracetamol are two separate drugs. For example, paracetamol is processed by the liver, whereas ibuprofen is processed by the kidneys. Now, broadly speaking, paracetamol is a good all-purpose painkiller that has minimal side effects and minimal interaction with other medications, making it a good first choice for pain relief and fever management. Now, research has shown that ibuprofen is better at controlling inflammation-related pain, which can make it a far more effective choice in some cases. That said, ibuprofen has a more side effect profile than paracetamol. Common side effects with the ibuprofen include headache, nausea, and stomach upsets in children. It can also cause damage to the kidneys because, remember, it is processed by them. This is really important in small children who can get dehydrated very easily, and therefore the effects of ibuprofen can be accentuated, which is not something we want. This is why we don't recommend that you take ibuprofen regularly unless you have been advised so by a doctor in a specific case. In a nutshell, if you are looking for a first step to pain management, then paracetamol is your drug of choice. This is because it is safe, has far fewer side effects, and has less interaction with other medications. However, if you are looking to treat pain due to inflammation such as teething, muscle cramps, growing pain, or period pains, then ibuprofen is a far better choice because A, it acts quicker and also deals with the pain related to inflammation. So, can you use both? And the answer is yes. Broadly speaking, it is safe to use both ibuprofen and paracetamol together. And this is because they don't interact in any way and they work independently of one another. However, it's important that you follow the instructions on the packaging that relate to your child's age. I recommend staggering both medications. So start first by giving paracetamol to your child, and if they continue to be in pain or have a fever, then you can offer them ibuprofen 2 to 3 hours later. This works well and provides better pain and fever relief. So what are the risks of taking them together? Now remember, with any medication, there is a risk of overdose or getting confused about what you have given and when. The easiest way to overcome this is to keep a record. And the way I recommend parents do this is either to keep a pen and paper by their medicine cabinet so they record what they've given and when, or they WhatsApp their partner or whoever else is helping them looking after their child. So you WhatsApp them what you've given them and at what time you've given them to avoid any confusion or any overdoses happening. Remember, both of these drugs are designed for short-term use. If fever or pain persists for more than 2 to 3 days, it's best you consult a healthcare professional or a doctor as soon as possible to find an alternative way or to get the bottom of why they are unwell. So these are your take-home points. Both paracetamol and ibuprofen are effective drugs at controlling pain and managing fever. Paracetamol has minimal side effects, making it a good first-line choice. Ibuprofen may work faster and may be more beneficial for inflammation-related pain, but has more side effects such as headaches, dizziness, and stomach upset. Now remember, both of these drugs are designed for short-term use, and you should consult a doctor if you are taking them for longer. finally, start with paracetamol for generalized pain. If this is ineffective, move on to ibuprofen. Remember, they can both be safely used together, but you do need to follow the instructions on the bottle. Thank you so much for watching, and I hope you found that useful. If you have any questions, pop them in the comment section below, and remember to hit that like and subscribe button and share this with any friends or family or anyone that watches your children. Thank you for watching.